Okay, great. So my name is Rachele DeCrescenzo. My company is The Healing Journey, Myofascial Release and Physical Therapy. I'm a physical therapist, and I specialize in a type of hands-on treatment called myofascial release, and it's very specific and individualized. And I'm speaking today, so I'm not going to do much more than that, except for kind of go into my deck, share my screen.
I have to stop. Let me stop sharing so you can.
All right. Okay, can you guys see my screen?
Perfect.
Okay, great. So like I said, I'm a physical therapist. I'm going to talk today about reducing pain and dysfunction with myofascial release. I've been a PT for 16 years. I've done worked with adolescents to geriatrics and everything in between in multiple different settings. I've always wanted to have my own practice. And when I started to take classes and learn more about myofascial release, I really knew that it was kind of the missing piece to the puzzle, and it was something I wanted to focus on and something that would allow me to achieve that dream of having my own practice. So I've had this business for just over a year, and it's going really well so far. So when I speak about myofascial release throughout this lecture, I'm speaking specifically about the John Barnes approach to myofascial release. And it is a little bit different than just the term myofascial release. Other therapists may use that term, or massage therapists, or in the medical profession, you may hear the term, but the John Barnes approach is very specific. He's a physical therapist and a massage therapist, and he has developed this overall approach to care and to myofascial release, and he's been honing his skills and teaching and training all over the world for 60 years. He's in his 80s. He's an amazing man. He's still teaching and training. And so as I say myofascial release or MFR throughout the rest of my slides, I'm speaking specifically about his approach. Just in general, MFR is a safe, holistic, and very effective hands-on technique that involves applying gentle, sustained pressure into the myofascial connective tissue restrictions to eliminate pain and restore motion. And I'm going to jump back to this slide towards the end, so hopefully that general definition makes a little bit more sense after I've gone a little bit deeper into what exactly MFR is and what fascia is. The John Barnes approach is a therapy that is very safe, it's very gentle, and it's consistently effective in producing results that last. So trauma, whether it be emotional trauma or physical trauma, inflammatory response, or surgical procedures can create myofascial restrictions that can produce multiple symptoms throughout your body. So chronic and acute pain, headaches, migraines, numbness, tingling, weakness, jaw pain. This is just a few of the symptoms, more common symptoms that I see in my clinic. The benefits of MFR include reduction in pain and tightness, improved posture, improved daily functioning, greater flexibility or ease of movement, improvement in sports performance, higher energy levels, and increased body awareness. And the increased body awareness is really one of the key things that makes the John Barnes approach different. And I'll speak more about that increased body awareness later. So to understand myofascial release, we really need to understand fascia and what fascia is. So in our bodies, we have a fascial system. It is a three-dimensional web of connective tissue that runs continuous from head to toe. So on the slide on the right, it's a picture of fascia. You can see that it looks like a spider web. There's areas that are thicker, there's areas that are thinner, but there's really no start and stop. And as I said, it's a connective tissue. So it literally connects everything in our body. It surrounds and infuses every aspect of our bones, our blood vessels, our muscles, spinal cord, internal organs, all the way down to the cellular level. So again, you can't think of it as a one-dimensional structure. It's three-dimensional, and it just infuses down all the way to the cellular level and supports everything around it. It does not have a beginning or an end. So, like bones or muscles, we think of the bone of our upper arm starts here, ends here. It has a definitive start and end. The fascia does not. It is one system throughout our whole body. It's the only system in our body that touches every other system. So therefore, it can affect every system of the body. Just to give a little bit more of a visual of what that looks like. So on the left is just the cover of one of John's books. It's an Healing Ancient Wounds, excellent book. And on the right is just a photo from that book and another visual of just what fascia kind of, if it illustrated what it might look like. And you can see that it just kind of moves throughout the whole body. It's intertwined, it's all jumbled up, and it has no start or no end. This is another visual I like. It's the cover of another book called What's in Your Web by a physical therapist named Phil Tavolacci. I like this visual and I show patients this often because again, it just gives another idea of what the fascial system looks like. In this picture, there's definite thicker lines and thinner lines. And I think that's really important. Again, it's one structure, but there are thicker areas to it. Like what covers the fascia that covers our brain and our spinal cord, because they're such sensitive and important structures to our body, is definitely thicker than the fascia that covers our forearm. And I like this, that it shows that. Something else that I show patients is this little ball here. It's called, I think it's pronounced Hoberman sphere. And I like this as a visual because it is three-dimensional. And you can see if I hold the bottom of the ball and I pull anywhere on the ball, it opens up and the whole system moves. And that is kind of what happens with the fascial system. So even if I'm moving my arm, there's some part of a pull throughout the whole body. And if there is, so inside the ball, or if I go back just a couple slides to this one, what looks like space in between the white is not space. It's not air. It's fluid. There's a fluid-like substance, a gelatinous-like substance inside that runs throughout our bodies that provides shock absorption. So that, if we fall or we get hit, there's a shock that happens that is allowed to happen and our body can bounce back. And also through that space, again, it's not empty space, there's nerves, there's blood vessels that all intertwine. Your lymphatic system all kind of falls through that three-dimensional web that should move nice and fluidly, but often will get restrictions. So if I hold down on this section of the ball and now I try to pull it open, you can see the whole system is affected, that it's not stretching in the same way as if I let that go and I open and close the ball. So the fascial restriction in one part of the body can really, it can have a three-dimensional web-like effect throughout the whole body. So this is another visual that I like. So let's say the site of the original injury is the low back. You're out walking your dog in snowy weather, you fall on your butt, you fall on your back. That's the site of the original injury. And let's say that injury knocks your pelvis out of alignment. It means the pelvic bone or two pelvic bones can move slightly independently of each other. And the pelvis is really the center point of our body that provides structure for everything above and below it. So let's say you kind of knock your pelvis out of alignment from that fall. You don't really have any pain in your low back, but now every time you walk, your pelvis isn't where it should be, and it's creating abnormal stress throughout your body. So that the site of the original pain now has a spider web effect where the fascia can tighten up and really symptoms can show up in other places. So as you can see there, that there's kind of lines of pull. Now it doesn't have to happen everywhere like in this picture. The picture is just meant to show that the fascial restrictions, the fascial lines that can eventually cause symptoms can kind of reach everywhere. So the original injury could have been in the low back, but then you can have symptoms and pain from that fall in your shoulder and your neck, even though you didn't hit that area when you fell. And one thing it's really important to note is that fascial restrictions don't show up on standardized tests such as X-rays, MRIs, and CAT scans. And that's really important because a lot of times fascial restrictions are missed by traditional medicine and traditional doctors. So, in today's world, medicine has become very compartmentalized. So if you have a shoulder problem, you see the shoulder guy at the orthopedist. If you have a knee problem, you see the knee guy. But, and the knee guy says, oh, your toe hurts, you got to see the foot guy. But we're not parts of a body. We're one whole body. So let's say you fell, like I said, and then, your back feels fine. 4 weeks later, you develop this shoulder pain and it kind of gets worse and worse and worse. So you go see the shoulder guy. If you don't connect that shoulder pain may have been part of why from your fall 4 weeks ago, most likely that orthopedic surgeon is not asking you, did you fall? If you don't connect it there in that 5 minutes that you're in front of them, they're not asking you that. So what's great about what I do and what MFR therapists do is it's a holistic approach. We look at the whole body. We think of the whole body as a whole. So when I sit in front of a person and I'm asking them questions and I'm trying to figure out what's going on with them, I will try to needle and get into what else has happened. What other traumas have you had, emotional traumas or physical traumas? Have you had any falls? Have you had any car accidents? And I'll ask about have you ever had a car accident? Because even if something has happened 10 years ago, 15 years ago, it still have effect on your symptoms today. So I'm really going to try to find what's going on. And then I'm going to look at the whole system. I'm going to look at how somebody's moving visually, have them move into all different ranges of motion. I'm going to look at their strain. I'm going to ask about pain, obviously. And I lost my train of thought. And I'm going to look at their whole system. So I'm going to get on, once I kind of visually look and we talk, I'm going to get them on the table. I'm going to get my hands on them. And that's really kind of the biggest thing is now I'm going to feel for those myofascial restrictions. So I'm going to go back to this, to the definition I shared at the very beginning. Hopefully you have a better visual of what fascia is. So MFR is a safe, holistic, so I'm looking at the whole body, effective, hands-on, ultimately I'm eventually going to get my hands on you, and that's how we're going to work. Technique that involves applying gentle, sustained pressure for a minimum of 3 to 5 minutes. So this is one of the other key things that makes the John Barnes approach different. Once I find that restriction, I'm going to hold it for 3 to 5 minutes into the restriction. So if you go see a massage therapist, they are massaging you, right? They're moving their hand over your skin and they are applying the pressure. They are putting the force into your body to, relax your muscles. And it does feel good. I mean, I've been for a bazillion massages in my life. It feels great, but it doesn't always have a lasting effect. How many times if you've gone for a massage, you go for the massage, you feel really good afterwards, maybe you feel good for a day, but the pain returns and you have to go for another massage. They're not making lasting effects because they're putting the pressure into your system. What I'm doing is very different. So if I'm feeling for restrictions, let's say, my hand is right here on the skin. I'm not sliding. I'm going to feel back and forth, up and down without sliding to see, does the skin and the tissue underneath feel restricted? So it should move all around. If I get to a spot and it's just kind of stuck, it doesn't feel like it's moving, that's where I'm going to keep my hand. I'm going to apply that gentle pressure inward, and then I'm just going to wait. And the waiting, there's a lot of cellular things that happen underneath the skin and the tissue. It's beyond this discussion that allows for the fascia to start to open up and release. But as it releases, now I'm not sliding like a massage therapist. I'm keeping that sustained pressure and I'm following where the restrictions, where I feel that the restrictions are starting to open up. So now that tight web starts to open and release and allow now for the more space. And if there's more space, now the lymphatics, the nerve, the blood vessels that come through that were all tightened down by the fascia and creating their symptoms have more space to do what they need to do, and the symptoms and the pain will dissipate. So the time factor is very important, and everybody's very different. Again, it's, massage is, I'm taking my hands and I'm massaging a certain area. I'm applying the pressure. I'm deciding which way my hands go. With myofascial release, how your body releases is going to be different for everybody. I'm following your body's release. So it's just very different. Like my hand might sink deeper, it might rotate. I'm following how your body's wisdom in how it releases. So it's a very different approach to care. Okay, how am I doing on time? Because I feel like I could.
Now 2 more minutes and wrap.
2 more minutes. Oh no. Okay, I'm going to go through these things extremely quickly then. The next part. So the other part that's kind of different and unique to the John Barnes approach is the mind-body connection. So again, a very holistic approach to care. When you go see, a regular kind of Western medicine doctor, they are not asking you about your emotions, about the mind. But again, we are a whole body system. We cannot separate the mind from our physical body. And fascial restrictions can also occur or show up because of our unconscious bracing patterns against stress, beliefs, or blocked energy. So you may not have any physical thing that happened to you, right? Maybe you didn't have a fall, you didn't have a car accident, but you are under constant stress. That constant stress causes, I'm gonna skip ahead here, can cause you to be in this constant state of higher arousal, or your sympathetic nervous system is always working hard. So you have increased heart rate, increased blood, you breathe heavier, your pupils are dilated, you get stuck in this fight or flight response. And if you can imagine, like if your heart, let's just use the heart for example, the heart is always beating faster and working harder, then the fascia around it can tighten down and also is under more stress. Now, if we think of it as a whole body system, that fascia, how that affects you physically can show up as a lot of symptoms. So that your emotional stress that you're under can show up as physical symptoms. So if we just use, again, you're having shoulder pain and you see the orthopedic surgeon and he takes x-rays and MRIs and he sees nothing, well, you still have pain there. You still have limited motion. Where is that coming from? He may send you to physical therapy. He may put you on painkillers or muscle relaxants or anti-inflammatory, but he's not getting to where is it coming from? What is the problem? And if it is at all part of an emotional issue, the orthopedic surgeon is not getting to it. But through MFR, as we release the fascia, not only do we release it structurally so that the web starts to open, we can release those emotional things too, because our tissues have memory. Our body remembers everything. And the emotional stress can also be released by releasing the fascia. I know that's probably maybe a little bit out there and might be a little bit confusing. I wish I had more time to speak about it. And the last key, the key to healing is feeling. And a lot of times in life, we don't want to feel. We just keep moving. We don't want to feel our pain, so we ignore it. And we can dissociate from our body because we want to we have work, we have to take care of our kids, we have a million different chores to do, and we just keep moving forward. So we completely ignore our body. And if you're not in your body and feeling, you're never going to heal the symptoms that you're having. Self-treatment is really like a cornerstone to this care. Of course, I see you in the office, but I'm always going to give you things to do at home, and the self-treatment is extremely important part of what you do. This was just a really quick, one thing, a lot of people hold a lot of tension in their jaw. This is just a quick jaw release that I give people a lot. If you hold your hands on the side of your face with your thumbs behind, and you apply some gentle pressure in, and then you hold that pressure and you slide your hands down a little bit, you'll get a release in your jaw. Jaw pain can cause ear pain, it could cause head pain, it could cause migraines, headaches, neck pain. So this was just a quick idea of what a jaw release, just to show you guys a quick self-care references and to answer any questions. And I wanted to say that it's a very different approach to care. It's not massage, it's not traditional physical therapy. The best way for you guys to promote me and to understand what I do is to experience it. So I want to offer anybody that's on the call today to get in touch with me. I would love to see you in my office. You know, I'm offering a free session to anybody on the call, or if you don't want to come in yourself, if you want to send your spouse or a child to come in and have a session with me, because again, I hope you have a better idea of what it is and what I do. But the best way to experience it and to talk about it and to tell others and maybe identify people that I could help is to really experience what it is. So definitely get in touch with me if you'd like to take me up on that offer. And if anybody has any questions, I'd love to hear them.
How long does a typical session last?
A typical session is an hour, but I do see some people for an hour and a half, especially if it's at the beginning, there's a lot going on. I'll see them for an hour and a half session, just to kind of get them going.
Rachele, is your service covered by insurance?
I don't take insurance. No,
Okay.
It's a fee for, cash-based business. I can create a super bill for the patient and they can submit to insurance on their own. And I have had patients that will submit to their out-of-network benefits and get reimbursed.
Okay.
But dealing with insurance companies is literally a full-time job. I mean, you really need a whole system of people behind you to, all the different plans and the different companies. That's one of the huge reasons I kind of left what I was doing and decided to do this on my own, so that, I can make decisions with my patients and it's just me and them making the calls on their therapy. There's no insurance company that's telling us how many visits I can see them, how long I can see them. Insurance companies are horrible. And that's why, that's a whole nother discussion, but that's why doctors spend 5 minutes with you, because that's all, if they spend longer and they do a full exam, they're not going to get paid. So it's a churn and burn, unfortunately. And that's what's happened with therapy too. So with this, it's me and the patient, we're partners and we decide what's best for their care.
Awesome. And what do you charge for a session?
I charge $150 a session. I do give packages, 5 and 10 session packages that provide a discount for a bit of a discount on that. And I'll work with people. I mean, I really want to help people. If that's really completely out of the ballpark for somebody, I'll work with them for sure, because I just think it's such an important therapy.